in terms of services and programming when it comes to crisis, addictions, and mental health?
Yeah, so I can talk a little bit about our crisis programs. We actually offer an array of crisis programs, starting with a 24-hour phone line. So you can call the crisis line at any time, 24 hours a day, 7 days a week, and you'll always get a live answer. And you'll meet with one of our crisis staff via phone, and they'll support you through that crisis and help connect. We also have a walk-in clinic 2 days a week, 225 Fairview Drive. So that's open Mondays and Wednesdays from 1 to 7. About 20 minutes is our average wait time, but anyone can come in and they'll meet with a counselor within about a 20-minute time frame. And the counseling sessions are usually about an hour, and again, we'll help connect to other supports as needed. We also have our fairly new Coast team. So that team went live in April. So this is a secondary response team in partnership with Brantford Police and Brant County OPP. So we support clients in the community in the venue of their choice, usually in their homes, with a plainclothes police officer sometimes, and sometimes just some frontline staff. So we'll go out and support clients who have already been through a crisis or might be beginning of a crisis, and connect them to other services as needed after that. We have our MCART team, which is also in partnership with Brant County OPP and Brantford Police. So that team pairs a police officer and a mental health specialist, and they respond to 911 calls in the community that have a mental health related concern. So that staff is on site with the police and supporting clients and avoiding apprehension and bringing to hospital. And then they'll connect back to our Coast team as well. We also have a pilot project in partnership with the city and Laurier and Grand River and Brantford Police, and that's called the BDOT team. So that team works in the downtown core, and we have a nurse practitioner, a peer support worker, concurrent disorders clinician, and the coordinator, and they're connecting with clients right in the downtown core. So connecting back to the RAM clinic or to housing or different supports that they might need.
Right.
So that's crisis in a nutshell.
When we're talking about crisis, what kind of things do you typically see?
It could be anything and everything. So my version of crisis and yours would be really different. So anytime that someone just needs a little bit extra support, it could be talking about a situational crisis or something that has been leading to a bigger crisis. Honestly, it's really depends on the individual person. And like I said, crisis is really different depending on who you're talking to. So we're supporting everybody. Great. And we're all ages.
That's amazing, and it sounds like the work that you're doing. Like, you have so many services and so many programs, and the fact that you offer that counseling within like a 20-minute wait period, so it's quick. The response is quick, and then you also have the services. You're going where they're needed too, right? Like, you're not expecting people to come to you. Exactly. You're going right to where it's needed. And
those changes happened, like I said, in April. We were operating the walk-in clinic 7 days a week, and we found that clients weren't getting to us. So that's where we changed things up, and we implemented the Coast program. So we still have walk-in a couple of days a week for people who want that office-based, but we're able to go mobile and that support people really where they need us, and we're finding that being really successful.
Amazing. And Kim, what's offered specifically for addictions and mental health in general?
Absolutely. Yeah. I think similar to the crisis services, we also try to decrease the barriers for people accessing our services. We have lots of office-based services, but we do identify folks who might need us to go out to them. So we sort of offer the full continuum of addiction services. So we do screening and assessment at our Fairview location. Assessment means you're just basically gathering as much information as possible from the person about their circumstances, what their goals are, what their motivations are, and then we collaboratively develop a treatment plan that's unique to that person. So how are we going to help you to get to your goals? And we can offer outpatient-based counseling, office-based counseling on a weekly or bi-weekly basis. We also offer a lot of group programming to support clients. We also offer day treatment program, which is a 5-week program, 5 days a week. People attend for about 4.5 hours out of the day. So this is a little bit more intensive. So generally for folks who have an issue that's identified as more severe, and they need a little bit more support. And then we also just recently, last September, opened our residential treatment program. So we also have a 10-bed treatment facility. So folks stay with us for 5 weeks and receive those intensive services. And at the same time as we opened that program, we opened our withdrawal management and treatment services program. So this is sort of short-term support for people in withdrawal from substances. It's a non-medical facility, but we have a great partnership with the Rapid Access Addictions Medicine Clinic, and we have physician support from there. And we also are heavily involved in the RAM clinic that opened about 1.5 years ago. So we have a concurrent disorders clinician there every day, as well as the coordinator of that clinic sits within our program.
Right. And now if somebody needs assistance in any of those capacities that you have services for, how do they go about knowing where to go for those?
Yeah, they can call our Fairview Drive location, which is 754-0253. And then our withdrawal management and treatment service program, they can call there directly. They can call 24/7 and can get screened over the phone to access some of those services. So they call there at 753-6222. So it's just as simple as a phone call, and whoever picks up for you is going to help you with those next steps and navigate what might be the best match for your circumstances.
Right.
Now we have all these new services that have came out that you've touched on, and big changes being made to the services that you offered as well. We know that Brantford has had in the past week 4 opioid-related deaths. Are we seeing a bigger problem here than in other communities?
Well, I think the data demonstrates that Brantford, like many other communities across the province, are really experiencing some challenges related to opioids and other substances as well. I think we have pretty high rates of morbidity and mortality related to opioid use in our community. It's one of the reasons that opening the new withdrawal management center was really important for the community, and we absolutely do see a lot of clients who have an opioid use disorder, and we support their detoxification and try to link them to ongoing services and supports so they can maintain their recovery goals. I would say that our community has a substance use crisis, not just an opioid crisis. And I think there's some variables in our community that make us a little more vulnerable to those things. And I think that's why we at St. Leonard's work really closely with all of our partners to try to provide a wraparound, holistic approach to supporting someone who might be experiencing those challenges.
And I think it's really important to note too that St. Leonard's is doing work that's both reactive to the situations that are happening, but also are very proactive in the services that they put out. I know a lot of people can look at what the headline says and what's going on, and then a new service comes out because of that, but there's so much work that's going on behind the scenes that people don't know about because of the work that you're already doing and have in place.
Yeah.
So thank you for that. Can you explain what supportive housing is and why it's important to our community?
Sure. Yeah, I think so. We have a couple different programs regarding supportive housing, but basically it's a program where we're putting clients in affordable housing units with some subsidy backed into that, and then we're also connecting and supporting them while they're living there, with the goal to eventually support them in becoming independent, so that we can move them out of that unit or move them into a different unit and bring someone else in and support them. So it's really about that wraparound approach. We're connecting them to services within the agency and with our community partners, and just making sure that they're well connected and they have that support while they're working through whatever it is that they're working through.
Right.
I think housing is a basic need. And when somebody is inadequately housed or homeless, they're really challenged to address some of the other things that might be going on in their lives. So we try to create a housing first approach where we create a stable home environment, and then we can support somebody to address some of the other things that have challenged them, and hopefully then they move on to independence and don't require that intensive support anymore.
Definitely, and earlier guest Mark LaFerrier mentioned, and Becca McClellan too, we had the discussion about how can you expect somebody to really thrive in their life when they don't have just those basic needs met. And it's one thing to have a roof over your head, but then if it's cold, or now you look at somebody that's on the street and doesn't have those opportunities to have a safe place to sleep, it just doesn't. You can't expect them to get a job is not the answer to them. Right?
Well, and I think that's why we've tried to implement programs that are more on an outreach basis. So we're meeting people where they're at. If you don't know where your next meal is coming from and you're going to sleep in the freezing cold tonight, an appointment-based service isn't going to meet your needs. We have to be a little bit more flexible and sort of dispense with some of our traditional ways of supporting people to make sure that we're reaching people where they're at. So we're making it as barrier-free as possible.
And when we talk about our beat-out team, that's exactly what they're doing. So they're downtown in the core. It might just be a bottle of water or something warm to eat, but it's really about connecting people where they're at and then building that relationship and supporting them with whatever their goals look like down the road.
Right. And are you finding that the individuals that you're interacting with that team, are they responsive?
Absolutely.
Yeah.
Yep. And like I said, it starts really small. It's all about building relationships and meeting them where they're at. So sometimes all they want today is that bottle of water or that something to eat. But the next time we talk to them, they trust us a little bit more, and we're starting to build build on that relationship and rapport, and we're connecting them. Sometimes it's about walking them to that appointment or going to find them because we know they have an appointment and they're not mostly like going to remember. Trying to connect them, walk them to it, and also supporting them and advocating for their needs. So sometimes that's really hard. For someone who's struggling with lots of different aspects to really advocate for what they need, and that's where some of that the BDOT team can come in and really help them and be their voice if they need it.
Right.
That's fantastic.
Yeah, and I just want to speak to, like, you both have been working with St. Leonard's for quite a while now. It must be very rewarding to see, like with the staff that's there, to see the change. And a lot of the people may not see that change directly because they're looking at headlines. Can you speak to the change that you see in our community?
Yeah, I mean, I think that it's easy to get caught up in, in some of the challenges that we're experiencing, but I think the rewarding piece is that we see individuals every day that are regaining their health and well-being, they're meeting their recovery goals, they're leading proactive lives, they're rebuilding relationships, and that I think instills a lot of hope that we don't often hear about when we're talking about the challenges that we're facing. But that's the other side of that coin, right? Where there's challenges, there's hope and supports to help people get there.
Right. That's amazing. And I think we've got about 5 minutes left, but we would just want to speak to what St. Leonard's has as far as harm reduction.
Yeah, I mean, our approach in general is harm reduction. So when Katie says we meet people where they're at, that doesn't just mean a physical location. It means what is a manageable objective for you? What are your goals and how can we help you attain them? And that's not always, going 100 miles at once. It's one step at a time. I think we also work collaboratively with our partners, in particular the Brantford County Health Unit, around the distribution of safe use supplies and naloxone kits. So we are receiving members of the public, teaching them how to use naloxone to try to prevent overdose, providing them with safe use supplies to decrease the incidence of disease transmission in our community.
I read recently that there's a convenience store downtown Brantford that's they have test kits for drugs. Do you think that that's a safe way for people to go about if they are using substances to use the test kits ahead of time to make sure that it's a safe product, or are those faulty sometimes?
Well, I think it depends on the source, but a lot of safe consumption and treatment sites that have opened in the province of Ontario do embed that supply testing into that. I think what is true is it's really difficult for someone to know what they're using. We're not talking about a legitimized supply chain. So I do think any efforts for people to make informed decisions about what they're doing are positive efforts.
Definitely.
Awesome. And you touched on the community being educated on the naloxone kits. What else can the community do to better support the individuals that may be experiencing crisis, and also St. Leonard's?
Well, I think we have lots of different groups. We do offer a group for family support. So if you're a loved one struggling, supporting someone who's struggling with addictions, you can access that program. It's an open program. You can come in and meet with the counselor in the group, and that's really helpful. I think also when we talk about crisis services, we also support families. It doesn't have to be the individual that's in crisis. We can absolutely support the family, give them some guides, connect them to the other resources as needed. Train them in naloxone kits, give them a naloxone kit. There's lots of different options. But I think as an agency, we try to really support the family and caregivers as well if we can.
Right.
Yeah.
I think it's important I would encourage people to really approach someone in crisis, someone who's struggling with compassion. And I think that sometimes the smallest act of compassion can be the starting point for someone's recovery journey.
Amazing. Thank you both so much for joining us. I'm really excited to have you here. Thank you for the work that St. Leonard's does and all, like, your whole team. Thank you very much. And we'll be right back after this break.
John Lennon famously once said, "Life is what happens when you are busy making other plans." In 2011, Jean-Francois, a married father of 2 young children, could probably relate. After all, he was busy, his life teeming with work, more work, volunteering at the community hockey rink, and little of anything else, until
there was a bit of a wake-up call when at one point my wife turned to me and said, "I feel like I'm a single parent."
Those jarring 7 words convinced this proud man to reach out to his family doctor.
One of the first things to come out of the nurse's mouth was, well, we haven't seen you in 8 years. I'm not sure you're still a patient with us. So in typical male fashion, you know, I didn't feel sick per se, and so, you know, I would forego the annual checkups and that kind of thing. You know, it's funny, I would religiously follow my car's maintenance schedule, but when it comes to doctor's appointments, a good 8 years had gone by since I'd last seen my doctor.
Expecting he was suffering from burnout, Jean-Francois was surprised to be diagnosed with depression and ordered off work immediately and focused on his recovery, which included talk therapy, exercise, and a regimen of antidepressants. The results were very positive.
That was the best decision I could have made. And again, there was a defining moment there because out of the blue one day, my daughter ran up to me. She gave me this huge hug, unprompted, and said to me, "I love the new daddy." That will forever stay with me. And that's when I knew that I'd made the right decision to start treatment to get better, not just for myself, but in the end, it's really your loved ones that suffer equally, if not more.
Buoyed by his ongoing recovery and with the support of his family, Jean-Francois decided he wanted to give back. During his journey, he was struck by the limited amount of mental health information specifically targeting men. He soon came to understand why.
Depression is diagnosed twice more frequently in women than it is in men. And yet there's no sort of biological basis that we've found yet to explain such a difference. So essentially, I think it's because men are not seeking help because they believe they have a mental health issue. They're much more apt to report physical symptoms. That certainly was the case with me.
Jean-Francois decided to launch Men's Den, an online portal featuring a compendium of key mental health information and resources aimed primarily at men. He also became an extremely active mental health advocate on social media.
But as I got engaged on Twitter and through initiatives like Bell Let's Talk, I started growing an audience, partially because of my communications background. I was able to, essentially tweet out a lot of relevant, timely articles on mental health issues. So people, I think, sort of subscribe to that. And so through that information sharing, I started developing quite of a following on Twitter.
Quite the following it is, numbering more than 5,000. But his outreach efforts don't stop there. He also lobbied civic officials to launch the first and now annual Men's Mental Health Awareness Day in Ottawa. The response to his initiative has proved to be therapeutic.
It's rewarding when you have people come up to you and say, "Thank you so much for sharing your story. I'm living through this," or "My spouse is living through this." And so that in of itself, I feel, has helped me in my recovery because helping others feels good. And for somebody who has chronic depression, you're looking for a way to feel good.
Thanks for kicking back with us. We are very fortunate that we have Mayor Kevin Davis here to join us, as well as Aaron Wallace. Aaron is the Director of Strategic Planning and Partnerships for the City of Brantford. Aaron, can you tell us a bit about the community drug strategy?
Sure. So the community drug strategy was published in 2017, and it was kind of looking at 3 different things. And one was, I think that our health unit and the police and some other stakeholders had noticed that some of the challenges of the opioid crisis that were moving west across the country had arrived in Brantford. So there needed to be some sort of coordinated response around that. We also knew that cannabis would soon be legalized as we were thinking about that strategy as well. And there was also a piece around how we support youth and do some youth prevention in a more coordinated way. So some of the work that was done is we talked to a lot of stakeholders, we talked to a lot of people with lived experience of substance use, we talked to youth themselves, we did a lot of research and background research on best practices. We came to this a little bit late. Other communities have had drug strategies for maybe 8 or 10 years, so we kind of relied on some of their learnings as well. But at the end of the day, really what the drug strategy is a menu of about 25 or 30 things that really, if we did them, And not all of them we can do overnight, not all of them the community can afford right now. But if we did those things on that menu, we'd start to see some productive gains in terms of the numbers of substance use and the impact of substance use. Because what we can tell you is that in Brantford, the incidence of substance use is 10 to 15% higher. Of course, we're seeing some of the impacts of opioids in terms of death and hospitalization. So really what we're asking the community to do around this strategy is, if you're the health unit, you're the city, you're the police, you're a nonprofit provider, what are the things on that list that you could start to do? And some of the concrete examples of that would be things like an outreach team. We knew we needed some support in the downtown core to find some of those folks. We needed an addictions medical clinic. That was something other communities had that we didn't have. We needed to kind of get the conversation around our detox center kind of up and running again. So it was kind of those things on that list that we started to slowly pick off and start to do. And that work continues. That work will continue for years, if not decades, as we continue to kind of look at best practices and pick some of those things off the list. So then kind of in a nutshell, that's what the strategy is. What should, as a community, we do together based on what other communities have done well, and what's unique here in Brantford that we could be doing?
Great, thank you. And Mayor Davis, what are some of the programs that Brantford needs to address for the community's struggles?
You're talking about our drug strategy to improve it?
Yes.
So what I'm going to tell you is my personal opinion, all right, based on being involved in this now for well over a year. And it's interesting, when you're mayor, you pick up a lot of information from a lot of different sources. So I'm an expert in nothing and everything. But my conclusions are a couple of things. One, Chief Nelson, our former police chief, before he retired, he was working on an initiative. It's called the Diversion Program. And what that does is, for those who are going through the criminal court system, and many people who have a substance use issue, they'll end up at some point in the criminal court system. And so the diversion program gives them an option. So instead of facing a fine or incarceration, if you take this rehabilitation option, you can avoid perhaps having a criminal record. And in other jurisdictions like Rhode Island, that's been fairly successful, because I know from personal experience with those who have alcohol abuse issues that you need to find a break point. At some point in their addiction, there comes a point where they are open to receiving treatment. And generally when they get into a situation where there are consequences, right? It might be a family intervention, it might be losing a job, it might be their family breaking up. For those that I've talked to, some of those who've recovered from an abuse issue, oftentimes it's been the criminal court system. So I think a really good diversion program would be effective. And that's not something a city can do, because that's the courts are run, the criminal court system is run by the province. It's been done in other jurisdictions. I'm encouraging the province to devote resources to that. I think that would be, money well spent. The other thing is, they call it upstream. Upstream means, what can you do to prevent, primarily young people, from acquiring a lifestyle that includes substance abuse? And the research that I've done out of programs that it started in Boston, Massachusetts, a program adopted in Glasgow, what it is called youth intervention strategies. We have that to some limited degree in our community. Some of it's through the city, some of it's through private organizations. I think that it would be very helpful to have a more comprehensive they're called youth intervention initiatives. And we've got a community hub system that we could base that out of. We already do the Healthy Be Kids program, which is intended to get kids off their phones and have a physically active, healthy lifestyle. So the youth intervention programs that I've read about, they'll use a recreational program, let's say like basketball, to get primarily young men, it is, to get them interested in an activity that is productive, but there is a kind of a hidden purpose to it. And the purpose is mentoring them and teaching that there are good options in their life and good, healthy lifestyle options. And that's been very successful in other communities. But that's a generational thing. You're going to see the impact of that, 3, 4, 5 years down the line. The other initiative that we already have an early warning system the health unit is responsible for. I think that, and I've talked to Dr. Banke, he's our new medical officer of health, and we've been talking about what could be done to make that system better. I think in all aspects of our drug strategy, it's always a case of, I think this is in all our lives, we can do things better. And I think we can do better. And it's not that the system right now is needing substantial improvement, but it's like anything else in life. Let's work to improve it.
Right. And can you speak to, you mentioned it briefly there about the community hub. What is a community hub? Aaron?
Yeah, absolutely.
Aaron.
So, going to cast your minds back to I think around 2014 or 2015, and the idea was initially that if you could bring services into neighborhoods, you'd get a couple of advantages that way. So I say services, I mean things like social services or rec services, food programs, that kind of thing. You get a couple of advantages, and that would be that folks might more be likely to attend if it was closer to their home. And often people don't want to access social services through a social services provider, through the front door of the city social services or the front door of another nonprofit, just because there's a little bit of stigma and maybe embarrassment related to that. And so in 2015, we launched what we called the Neighborhood Hubs program, and we picked 3 neighborhoods, eventually became 4. And what we used is the community centers in those neighborhoods and said, we'll essentially take those community centers that do good work in and of themselves, but we'll call them community hubs or neighborhood hubs. And what we'll do is we'll bring social services there. We'll bring our partners like the health unit or St. Leonard's into neighborhoods. And what we found is that theory did hold, is that you had a lot better service uptake when you brought services into community centers. It was just kind of a comfortable place for people to go. And you also were able to kind of liven up the neighborhood services a bit in terms of people got excited about their community center. You had partners who would call and say, hey, I've got a program. Do you mind if I run it out of neighborhood X or community center Y? And so essentially what we do is we kind of look to our partners to see what services they provide, and is there an opportunity for them to take that to the neighborhoods? When they take it to the neighborhoods, you get a little bit better uptake, you get a little bit better kind of action. So that's in a nutshell. So it's kind of a living document. Kind of depends on what the neighborhood needs. Work a lot with the neighborhood associations in terms of the volunteers in that neighborhood, what they're seeing on the street, and what they think might be useful, and just bringing those services to the people.
Awesome. And when you're bringing the services, how do people find out about those events? Because it's not something that's all the time at the community centers, right? Or is it something that's full-time there?
So it's not, no, that's right, it's not full-time. So we'll do a calendar in advance, and then through our neighborhood associations and through our communications branch, we'll try to get the word out. And so it could be anything from, a drop-in for youth mental health, or Boys and Girls Club, or learn how to use an iPad. So we'll put those calendars together, we'll push them out, and we're hopefully, through our volunteers and through kind of peer-to-peer referral, we get folks to come in. Yeah.
Awesome. And I think you mentioned it, Kevin, too, about how to screen in other places for mental health, so doctors and schools. I think you touched on it briefly in what you had said. I think it's like looking at other opportunities to screen for mental health and the diversion program.
Well, because you're always looking for, I call it the entry point into treatment. And another example that I didn't touch on is a safe consumption treatment site. And that can be an entry point, like a ramp or a pathway for those who have substance use issues into treatment, because under the current provincial program, like there used to be injection sites 3-4 years ago, and the current provincial government very substantially changed that program, so there's a greater emphasis on treatment. That's why they're called safe consumption and treatment sites. Right. So, and you can't get provincial funding unless that's part of the services that are provided like on site or immediately near the center that you have. And so that's another pathway into treatment. And that's proven very successful. I've been to the Guelph Consumption Center twice. I'm going up there again with another group of people in March. The Brantford Community Health Center, which is making the application here in town, I believe they're modeling after the Guelph site, which is, it's worth visiting. They actually do visits, run tours every Friday morning. Wow. Because they've become a model for successful consumption centers across the community, across the province, I mean. So that's like another pathway into treatment.
Right.
Right.
And it's been a theme for the most of the day, talking about how individuals that may struggle with mental health don't have necessarily access to shelter, or there's so many factors that goes into somebody actually working through the problems that they have and seeking help, whether it be shelter, whether it be food, whether it be just safe spaces for them to be in. One topic that's been come up recently is definitely the new shelter in town. Would you be able to speak to the shelter?
I can speak to the shelter. So as it was right at the month before I became mayor, so council had commissioned a study into the whole shelter system and decided that the council, and we endorsed it as one of the first decisions that we made in the new council, more of a wraparound 24/7 service for the shelter. Before that, the shelter system we had was more of an overnight place to sleep. And so it was transformed with about, if you include what's provided at Nova Vita, around 60 beds. And we anticipated, based on the usage patterns, that would be sufficient. And then, of course, what happened this past October was with the arrival of cold weather and the fact that we had, I guess, growing homelessness in the community through the summer, as seen in the number of encampments we had through the city. So it kind of came to a head late October. We realized 60 beds would not be enough, and that we did not want people living in tents through a Canadian winter. Well, it's not good to live in tents at any time, other than just like go overnight somewhere. So we saw that. We asked staff, led by Aidan, by the way, to set up a winter shelter program, kind of model on what it is out of the cold in Toronto. So the intent being through the winter months, more of a overnight stay. We looked at a number of different sites. We ran that pilot program at the Beckett Centre during that real cold snap in November. And then in early December, with the help of the Rosewood organization, opened the shelter at the old police station. And actually that's been transformed since we first set it up. It's now more of a 24/7 facility, so that, you know, during the cold winter days, people who use the shelter can stay. And there's about 50 beds there. It can go to 60 in a pinch. So that's expanded our system to, I guess, about 100 to 110 beds. So that's happened. We are looking at what we're going to be doing in the spring, because that shelter will be closing the end of April. And we'll be looking at usage patterns through the winter, what it is that is required, and through the course of the summer we'll look at what we need to put in place to take us through the summer. The challenge is we haven't really budgeted for anything. We rated a reserve fund to fund the shelter this winter, and they're expensive to operate because you need security, you need staff in place. So it's going to be a major challenge for us as we move through this winter, what we're going to be doing through the spring and summer.
Right. And sorry.
And so that's just a shelter system.
Right,
but,
yeah.
you know, they call it the housing continuum. I just call it the whole range of housing, affordable housing. There's a lot more to what the city is doing to address the homeless challenge we have in our community.
Right. And Aaron, could you give us what exactly is affordable housing? Like as like a spectrum, because I think a lot of people get confused as to what that actually means.
Yeah, that's a great question. So sometimes I talk about like capital A affordable housing. So affordable housing under the Housing Services Act. And so that is housing that is tied to your income. And so when you hear people talk about the housing wait list or rent geared to income or rent supplements, those kinds of conversations, that's really about a person's income makes them eligible for some help with their rent. And so that could be that they go rent from landlord X, and maybe the rent is higher than they could afford, but because they're eligible for a social program, the province or the city or some combination of those funders pay some of their rent so they can stay there. And of course, we as a city operate units as a landlord, so you might be able to stay in one of the units that's owned by the city, and you'd be able to stay there for maybe 30% of what you would have to pay in the open market. Now, that is a very specific kind of category of affordable housing. Those are for folks that we check their income every year, they're still eligible to be on the list, housing comes available, and they get it at a fairly reduced rate based on what they make. When you think about affordable housing in the community, of course, it is, can I afford to buy my first house? Can I afford rents as the rents continue to go up? So you're not necessarily on a social program or on a wait list, but you're just having a hard time putting together the down payment for a mortgage, or a one-bedroom apartment 10 years ago was $800 and now it's $1,200. So people think about that in a kind of a more global sense of affordable housing. And so what the city needs to do is think about all of those things. The city needs to think about where can we find money to build more units.
We are thinking of all those
and I'll segue to the mayor.
Yeah, so I look at it. I think of it this way. So that the shelter system we have is designed for what we would consider to be the homelessness, those who are living it rough, right? And so you have that part of the system, and then you need transitional housing that hopefully they move out of. They have to move out of that system at some point, and so that's what Aaron was talking about in terms of the subsidized housing. So rents being fully subsidized, partially subsidized, and our housing affordability plan, the 506 units over 10 years, that's what that is about. And because we have very long waiting lists, it's 10 years for singles, It is about 2 years if you're a family. And so that's people, perhaps they might be in Ontario Works, ODSP, and they need a unit where the rent is fully subsidized. And so the program we have, the Housing Affordability Plan, it's to construct projects, buildings that the city owns, so that they'll be here, an asset of the community, not forever, but for a very long, long time. And the way the system now works, back in the 60s, you would have developments would be completely subsidized rent. And that created ghetto-like situations. So that's no longer done. What's normally done is it's a mix of unit holders, people that are renting for market rent. It's about a third usually, about another third would be partially subsidized rents, and the other third would be fully subsidized rents. So you have a mixed neighborhood, a building with a mix of different types of people and what their background is socioeconomic. So, but to do that, the city needs to make the down payment for those projects. And to develop 506 units over 10 years, that's going to require the city and the county, because there are partners in this, to come up with about $28 million. Now, they're going to cost a lot more than that, the buildings themselves, but you do that through mortgages, provincial, federal grants. So that's that part of that program. So the issue with Airedale was very much about where do we find that $25 million that we need. So that's that program. We struck the mayor's task force, and that's mayor, that's us apostrophe, because the mayor of the county of Brantford and myself. And that's intended to deal with doing more than what we're doing as a city, the 500 units. Part of it is we've invited those who are in the private home builder industry. So that's the issue of affordability for those who want to buy their home for the first time. They can't afford $500,000. So what can we do as a community, as a city, to try and make $300,000, $350,000 units available so more people can afford to move out of the rental market and into first-time home ownership. And that's why we have, in the Mayor's Task Force, we have representatives of the Chamber of Commerce, Brantford Home Builders, private developers. So for them to tell us what we as a city can do to help make that happen. And also amongst themselves can decide what can be done to address that part of the private market. And then there's the Indewells of the world, JCs, Kiwanis, where they develop co-op projects, housing projects. And so we brought them into the Mayor's Task Force as well. You know, what can we do as a city to assist you in the various developments and buildings that you've built, not in Brantford, unfortunately, mainly in Hamilton and Woodstock. But so they're a part of the task force. It's we had our first meeting last week, and Darren, you were there. What did you think of the
Yeah, I think there's
the tone of the meeting?
Yeah, there's a lot of interest in this, and because it does cover that entire spectrum, and because I think people recognize that what we see visibly as homelessness and some of those challenges is because of some of the bottlenecking in the housing system. And so, as the mayor said, if you can make home ownership affordable, then you can make rental a little more affordable, and then you can make that transition from folks that are in subsidized to rental, and the folks that might need that support to be in subsidized temporarily, they can move out of a shelter or off the street into that. So I think there's a lot of excitement in the room in terms of just the communal thinking about that, and people understanding that homelessness is not an issue of the city and building development is not an issue of the private sector. If we all have this conversation together, we can move some of this a lot faster.
And part of it as well, like rent, so those that can afford to pay rent, market rent. Well, the market rents in Brantford have increased dramatically the last 2, 3, 4 years. Part of that is, well, mainly a lot of it has to do with we sit right beside the GTA, and that growth is coming at us. And as the people in the GTA struggle to find affordable accommodation, they're looking at the Guelphs, the Cambridge, Brantford, Oshawa. So, and it's interesting, people say to me, well, can't we do something about that? That they're affecting our ability to have an affordable lifestyle here in Brantford. And I say, well, what do you want us to do? Build a wall? We can't keep them out, and they're going to come looking no matter what. And if you don't build anything, then supply and demand tells you that your prices will escalate rapidly and your rent. So part of what we're going to do as a city and have been doing is, like for example, the boundary lands. So this is about increasing the supply of private accommodation. Once we have those lands serviced, they're going to be private developers building on those lands, creating housing units. Downtown, we've had a program for many years with waiving development charges, and we're looking at the first part of this year adding to that. It's called a tax rebate program. You can only do it in certain areas of the city. What that does is if you build a rental development, a rental building, not a condo building, a rental building, the first year you pay 20% of the taxes, the next year 40%, year 3 60%, year 4 80%, year 5 you get up to 100%. And I know in Hamilton that's been very successful in the downtown, around the Hess Street area. Many of those new buildings are rental buildings, they're not condo buildings, because of those kinds of programs. So we're looking at doing that in the city. The idea being to increase the supply of rental units. Hopefully that will result in lower rents, but if nothing else, rents that don't increase as rapidly. So that's the private rental market.
Right.
Encouraging the builders of private housing and private rental to do more, with the assistance of the city and programs that encourage that. And we do have a lot of interest in builders and developers from Toronto in our downtown to build, medium and high density developments, which, we need that in our community to increase the stock. For example, last week at our planning meeting, we had a proposal for the old Canadian Tire lands. Another almost 500 units. A lot of it would be condos, some of it might be rental, but that's another 450 units that will be added to this community's supply of private housing.
Right.
So, that's exciting, and I think we're going to see a lot more of that.
Absolutely. And it's exciting to hear both of you speak to this topic too, because there's so many facets of it, and you don't realize when you ask a question of what is affordable housing, right? And it's a massive animal. Like there's so many different facets to it.
Well, it depends on who you are. So if you're a young family and you have enough money for a down payment, affordable housing for you is a condo or home that's $250,000, $300,000, $350,000. If you're someone that's on Ontario Works, it's having a rental unit where the rent is fully subsidized. If you can't afford to buy a home, but you make enough to pay private rent that doesn't need to be subsidized, then you're looking for an affordable rent. So depending where you are in life, it means different things to different people.
Definitely, and I think it really impacts the mental health of all the people living in Brantford. When you struggle to look for a house so that you're able to start a family or have your family move out, it forces a lot of people, especially people who are millennials like us, to be able to start moving forward with your life and moving out of your parents' houses, and then you kind of start to reflect on yourself and, am I doing the best I can at work to be able to afford a house? Should I have done something differently? Definitely.
And many of the social issues that we have, social challenges, whether it be mental health issues or substance abuse, or many times you'll see a common thread that weaves through each of those issues, and many times, homelessness is. I'm not going to say the cause, but many times it certainly exacerbates. If someone has a mental health issue, and if they don't have some good basic housing, then that's going to increase the stress level and could well then lead to the use of substance abuse. So in some cases it could be the cause, but there's no question that the homelessness issue and housing affordability affects many people in many different walks of life.
Right.
Yeah.
For somebody that is maybe watching at home and wants to learn more about what the city's doing and what the city has planned, where can they find that information?
Yeah, they can certainly contact the social services office, and any of our housing managers would be happy to give them an update on that. There's lots of great information on the website, so brantford.ca. So they can check the website. If there's spurs more questions, they have more curiosity, they're certainly welcome to call through to our office, and we can get someone on the phone who can answer some questions, for sure.
And the other thing is, I think we should be more demanding of the federal and provincial governments. I mean, think of the wartime housing we see in Eagle Place, right? And that's all across the country. You see it all across the country. That was servicemen and women returning from World War II that needed accommodation. And so it was the federal government that did that program because they've got the resources for it. Back in the 60s, they downloaded to the province. The province then downloaded it to us back in the early 2001, 2002. So I say to the provincial and federal governments, this is a national crisis, and we need you, provincial and federal governments, helping us, and they do to a certain degree. But
thank you both so much for being here. We
so
really
I'm going to cut us
appreciate
off.
your time.
You're not going to let us finish.
Yeah. Thank you both so much. We'll be right back after this break.
When a member of a close-knit family struggles from mental illness, it impacts everyone. Ruth Maxwell has experienced this firsthand.
Our nephew Mark, he was diagnosed with a mental illness when he started university. And in high school, we saw signs of it. He was always anxious when it came time for exams. But then when he went away to university, it was just way too much, and he had his first real episode. And over time was diagnosed with schizophrenia.
Touched by Mark's experiences and a desire to help others coping with mental health challenges, Ruth became involved with Project Upstream.
Upstream is a wonderful organization that provides continual supports for youth, adults, families in the community that suffer with persistent mental illness. So those people that are really challenged with mental illness, the hard to treat illnesses.
Inspired by the work of its dedicated staff and impact on clients, Ruth began a 6-year tenure as the director of the board of Upstream Ottawa. There, she was instrumental in procuring fundraising dollars to support and sustain vital client programs.
A typical client for Upstream is referred to us mainly through the Royal Ottawa Hospital. So once they've been diagnosed with a mental illness and on medication, they are referred to us for supports. So this client would be given housing. We have housing and a caseworker. So if there's appointments to see their psychiatrist or doctor, dentist, whatever, we help them do that. They get a bus pass so that they can become independent. And they're encouraged to seek out other clients from Upstream to get together with and socialize and try and integrate into the community.
Ruth is acutely aware that mental illness patients deal with unique circumstances that can set them apart from those with other conditions.
When somebody is ill with cancer, with a car accident, any kind of an illness, everybody runs to their support. And the very coping mechanism that the individual has is their brain. Whereas with someone with mental illness, the part that helps them cope is the part that's sick. So it's difficult, but there's nothing better than to give somebody a hug. There's nothing nicer for someone with an illness to be reached out to and feel loved and cared for. And I think that's why Mark, our nephew, is doing as well as he is, because he knows we all love him, and he's got a great sense of humor, and he's part of the family with a mental illness.
The impact of Ruth Maxwell's dedicated efforts have benefited many, many clients over the years. The countless hours of dedicated leadership and business savvy she has lent the Upstream have been vital to the organization's growth and success. Through all of her accomplishments, the clients remain her greatest inspiration.
The most rewarding part is spending time with the clients. You see what a difference, and they will tell you. I don't know that I'd be here if it weren't for Upstream. So it's a wonderful organization that I am very proud to be part of.
It has been an amazing 12 hours. We've finally reached close to the end of it. We're joined by Danielle and Rachel. Thank you so much for joining us.
Happy to be here. Happy to be here, yes.
Yeah, we wanted to just chat a bit about today and kind of reflect on what everybody experienced and what everybody thought. I mean, it's just, I always am blown away by just the amount of individuals that participate, whether it be on like the ones that you see on the screen with us as we're hosting and interviewing them, and then the guests that come, like, and then all of the people that are behind all of the equipment too that make this possible.
Yeah.
It's, and the community support too. It's amazing.
It's incredible, and it's really rewarding to be part of it, to see the community come together in such a powerful way. And I have to say, every year I learn something new, and again, I'm just leaving today with all of this new knowledge and information.
Yeah. Having done this for the first time, so it was a great experience just to be able to kind of, again, connect with the community and really understand and get a better picture of what support systems and help are available to a lot of people, in our communities, and that they really, there's a lot of accessibility. And I know the the guests that I interview is all about just they're here to help, and they just love to help, and they're passionate about helping, and just I saw that being conveyed. So hopefully people understand that help is there, and it's just people are waiting, and they're more than willing to kind of to give that help. So that was wonderful to see.
I think it was really unique having us having you join us on our team of hosts. I think you gave a really unique view on a lot of things, and also you brought some very special guests that I think were really gave a great contribution to the show overall. So thank you for doing that for us.
Absolutely, it's all about community and connection. What can we do to help each other at the end of the day?
Yeah, and it's sorry, Rich.
Oh, I was just agreeing. Community and connection. Yes.
Yeah, no, it's been, I mean, each year after year, the first year, second year, and now the third year, it's amazing to also see the progression in the guests and the hosts that we have on, where you see them come in, like even year one being extremely nervous to come on and share their story, and now year three they could come on as hosts, and they're sharing and they're helping other people share their stories, and it's just it's amazing to see that happen, and also to see the services that are out there now, and to see how those services were just being implemented when we first did the first kickback, and now hearing the success stories behind them.
Yes, and even businesses like Fog Off.
I think our community needed something like that, something where you're making a little bit of a joke about the whole topic overall, but in a very serious way. The way that they formed the letter F for it still is hilarious. I can't wait to check out the store, and I didn't really even hear about it until they were on the show.
I didn't either.
A little awareness,
Yes, a business. It's almost what they would call in the States as a B corporation, where they're almost acting like a nonprofit in a way, but also profiting. Businesses that give back to the community, I think is what I'm saying.
Wonderful, yeah, and I love the fact that when guests are waiting in the green room, they're connecting even before they come on, and there was a lot of support, because people are nervous if you haven't been on TV before, and there's a lot like that camaraderie and support, and we were watching on the conversations, and you're watching on TV, and when they come out, it was like, hey, you did great, and so just even businesses connecting behind the scenes, that was really nice to see.
And Mercasa, their pizza, their food, for feeding us. So good.
Tom, that arugula pizza.
I think you guys know what my highlight was. Thank you, Tom.
No, it's been a fantastic day, and it's each year it seems to go by like that much quicker.
Yeah, and that much smoother.
Yeah, exactly. Yeah. I don't necessarily know if people understand how much goes into what they see as the final product on the show.
And it's a lot more than just us hosting or the guests that are brave enough to share.
Yes.
It's also Patty. I don't know how she keeps it together back there.
Our unsung hero.
All day long.
Our producer.
Yeah, Patty's done great work. So.
She's the glue that holds it all together, and really is the one that, she said yes to us when we first brought the idea to her 3 years ago. But she definitely, without her, we wouldn't be here. We wouldn't be having these conversations. We wouldn't be sharing all of the amazing services and all the amazing people that we have in our community. So thank you very much, Patty. We really appreciate everything that you've done to continue to make this possible. And we've got some other individuals that we'd like to share. Actually, so that's me. So it's the end of the day, and we're trying to make this happen. So thank you to all of our hosts, guests, and to our production team at Rogers TV. We appreciate everybody's efforts, everything that went into this. It's incredible. There's, I think, over 100 people that really come together to make this happen, either in front of the camera or behind the camera. And thank you to everybody that shared at home, for sure. Yeah,
we really appreciate the support of the entire Rogers team. Jeremy's been doing some fantastic work, and he really believed in us and our values and our mission with Kickback. So for him to really go forward with what we had planned and make it all possible, we really appreciate that.
Right, and it's incredible too, all of the stations that to see it grow, to see the stations. Like we were broadcast today all across Ontario, Owen Sound to London to Ottawa, and even out to the Maritimes.
Yeah, Newfoundland
picked us up today too, which is just incredible to see that snowball continue to grow and just keep those conversations going. And I'm excited to hear the conversations that have taken place and some of the changes that have happened in people's lives just through watching the show and just through encouraging people to speak up and to share what they're going through.
Absolutely.
And Jeremy definitely was very instrumental in getting Kickback to be shared across all of those different platforms. It's just incredible that it's our idea turned into that, and just everybody that's made that happen is amazing.
Yeah, in addition to that, not only us being on the TV, but we also were on Facebook stream throughout the day, so if anyone wants to join and watch back some of the segments, it's all available on Facebook, which is incredible.
Right, yeah, from the Rogers TV Facebook page. It's also available on the Rogers TV website as well. It's also available on the Rogers TV YouTube. So if you missed any sort of segments that you wanted to take part in, by all means go to those different sites, Facebook, YouTube, the Rogers TV website.
And give us feedback on them too.
Search through, and provide feedback. And if there's any topics that you'd love to see in the future, we'd love to chat about that. And I guess we just committed to doing it again. But yeah, so we definitely love to hear from you. So I mean, as we're wrapping up, any final thoughts before we go? We've got about a minute left before we sign off from year 3.
I think of it just kind of like a word, like one word to kind of sum up everything that I've seen, experienced, and kind of been a part of today. It's all about community.
Yes.
Like a strong sense of community.
Right.
I would agree with that. Community, authenticity, and a whole lot of vulnerability.
And hope.
And hope. Yes. Yes. Resiliency.
Yeah. Awesome. So thank you, everybody, so much. This has been an incredible experience again. It's amazing just to now see, like, coming down to the final seconds and just thinking about all of the people that participated today, whether being in the studio, behind the camera, at home. Thank you so much for participating in however you did that. We're going to be signing off soon. Thank you so much for kicking back with us. We appreciate everybody here. Thank you, and we'll see you soon.
This program is brought to you by Ignite TV. Now you're in command. Visit Rogers.com for more details.
Call the Rogers TV viewer response line, email us, or connect with us on social media.
Add some to your life.
Let's go.
CTV Sci-Fi Channel free preview is on.
I'm bringing the party to you.
The hell are you doing out here, Picard? Saving the galaxy?
Fancy a trip in the box?
The crisis has begun.
I am attempting to save the multiverse.
Explore our universe.
Engage.
CTV Sci-Fi Channel free preview on now.
Your career is too important to just leave to chance. In order to move it to where you want to go, it's going to take some big decisions and some leaps of faith. Allow Rogers TV and the C-Suite to help you navigate your career to where you want to go. We will be sharing career tips, tricks, and ideas and experts that will help you to understand what it is that you want and how to get there. So at the end of the day, you are landing in your C or choice.